Mission hospitals were established with that really kind, generous, caring attitude, often on the part of individual missionaries who, we used to say they would take public transport to the furthest spot, get their bicycle out, ride their bicycle till the bicycle could no longer go. Then they would walk, and when they were exhausted and couldn't get any further, they'd say, this must be the spot for the mission hospital. And they were set in very, very far-flung areas, and still to this day, even though very primitive, often provide a level of care that's totally unavailable to the people in those regions.
In 1950, the Seventh-day Adventist Church established a Shaka hospital in western Uganda. Built on a hill overlooking the small town below it, for 60 years it has served the people in this region of a country at times enduring through war and political strife. For the past 11 years, Adventist medical missionary Dr. Victor Valenzuela has ministered to the people of Ashaka.
I grew up in the church. I was born into the Seventh-day Adventist Church, but I never thought of myself as becoming a missionary. Of course, during my younger years, I was interested when I was reading the guide, and I could read about the stories about the missionaries, but I never thought myself of becoming a missionary. But God has His own ways, and so here I am,
More than 1/3 of the Ugandan people live below the international poverty level. In Ashaka, the percentage is even higher. But the staff of the Shaka Hospital are committed to serving as Jesus' hands to a community in need.
It's an experience that I will never exchange for another, for any other experience in the world. There's nothing like working for our Lord.
A large portion of the medical patients they see each day are infected with HIV and AIDS. The pediatric ward is full of malaria patients. Yet the committed staff of Ashaka are saving lives and telling people of Jesus and His love for them, no matter how hard the circumstances get.
It's the joy of serving these people in this community, and doing it for the Lord. That's all that I can say. I have never felt that I'm tired emotionally or physically. We like doing it for the Lord.
Whether treating a child with malaria, attending a staff meeting, or simply enjoying the beautiful environment surrounding him, Dr. Valenzuela strives to use the gifts that God has given him for His glory and honor, no matter how difficult it gets.
I think sometimes there are moments wherein you'd like to do more, but because of the resources, the limited resources, you can't do much. So I think that's the toughest job that, Otherwise, me and my wife, we like working in this institution, and I can have it no other way except to be a missionary.
To further serve the community, Ashaka Adventist Hospital has established a training school to train laboratory assistants. Here, young people can learn skills they can use to serve their own communities. Students come from all over Uganda to take the courses offered at the hospital. They are taught by working professionals and are able to get valuable hands-on experience working in the hospital's labs. With the high number of HIV/AIDS, malaria, and tuberculosis cases coming to the hospital, having a fully functional lab is vital. Students live in simple houses, and each Sabbath the local church on the hospital grounds overflows with students, doctors, nurses, and the Adventist community that has grown over the years. Often patients, if their conditions allow it, are brought to the church so that they can join the worship service. Ashaka Adventist Hospital has blossomed into a caring and spiritually nurturing oasis to the people of Western Uganda. Recently, the Health Ministries Department of the General Conference, along with health professionals from Loma Linda University and the Eastern African Division, paid a visit to Ashaka to evaluate the hospital and its facilities. Each department was examined, and staff were given the opportunity to express their feelings regarding the quality of care being provided to the community. A report was prepared and then shared with the hospital administrators and staff.
At the hospital that will go over these recommendations. And we want to encourage them to do that which they are doing well, to do it even better. So we take the appreciative inquiry. The appreciative inquiry basically doesn't go around and say, you're not doing this and you're not doing that. It goes around and says, you're doing thus and so very well. If you could employ the same enthusiasm and the same methodologies to what you're doing so very well, maybe to this program or another problem.
Another member of the team was Dr. Peter Landless, one of the Associate Health Directors of the General Conference.
We see at this hospital, which is now 60 years old, a service to the community of Ishaka, a comprehensive service giving obstetrics, gynecology, some surgical cover, also with a family planning clinic and HIV and AIDS outreach, a very busy outpatients department, as you can see around me. There are people willing to come in and out of this hospital. As we look at the challenges faced by the hospital, of course economics are huge. Nothing becomes cheaper, and maintenance of the plant is important. Provision of adequate facilities is very, very important, and many things need to be upgraded. And so we see that we have a mission here, the hands of God being our hands, demonstrating His heart. And we thank you as you contribute, as you continue to serve by your mission offerings. Thereby you have a direct hand in helping to get doctors, nurses, missionaries right to where they need it, where they can give the expertise and help that otherwise would not be here. So continue to give, to consider your stewardship as you hasten His coming and help people in the process.
And I like to think that the members in the pews around the world are also friends of our missionaries, and that they will support them with means and prayers and maybe little letters of encouragement, just to let them know that we are all in this together, whatever our particular role may be.